Gum disease alone is bad, you know that, but did you know it's a portal for other kinds of bacteria? Yeah. Think heart attacks, Alzheimer's disease, pregnancy complications, all kinds of possibilities. Here to tell us more is Dr. Dwayne Keller from Keller Professional Group. And your friend, Dr. Keller Blodgett, actually ran into a pretty extreme case of this diabetes, right? Used your technique,
Right.
is that, correct me if I'm wrong,
Right.
and the diabetic markers were reduced, is that right?
He was treating the patient's gum disease, but they were also monitoring the patient's diabetic markers, their blood sugar.
Right.
And what they've found, and what research has shown, Kent, is that when you treat the gum disease, for a number of patients, you'll lower their diabetic markers. Doesn't mean you make them a non-diabetic,
Right.
but they're less of a diabetic. So what we found is that the bacteria associated with gum disease are associated with almost all the systemic diseases.
You had said that's kind of a portal, an entry place for
Correct.
bacteria that can lead to other kinds of diseases, correct?
Correct. What happens is you get an inflammatory response, and the cells around your blood vessels basically are eradicated, removed, and there's no cells between the bacteria and the host bloodstream.
Taking away the block.
And as a
firewall.
result, they can get into the bloodstream, and that's how we found that there's that association.
And we're looking at some of the pictures of, I guess, before and afters and such, right?
Correct. This is the patient before and after, and what they found was as the patient was able to clean up their gum disease with the Periodontal method, the diabetic markers went down. And that's just because that is a portal of entry of how these bacteria get in.
And we've heard that before with wounds and different things like that, the kind of problems that can cause for the whole system.
Well, and if you think of it, periodontal disease is a chronic wound.
Right.
It's exactly
Right,
what it is.
right. Talk to us very briefly about the technique itself that you use,
The technique
that you came up with,
right.
by the way.
The technique uses an appliance called a perio tray, and what it does is it delivers medicines up under the gum tissue so that you can then treat the cause of disease. If you treat the cause, you don't have the disease. Now we're finding that it also affects the systemic markers of the patient.
I know you've gotten a lot of acclaim for this and a lot of notoriety out of this, but it's really kind of a simple approach. It's almost like treating a wound anywhere else on our body, isn't it?
The interesting thing is, for years we dentists have treated a chronic wound with acute modalities. And
What is that?
Well, scaling and root planing,
Oh, okay.
wound debridement,
Okay.
those are all acute modalities.
Right.
The American Medical Association has guidelines. The first step is treat the cause of disease, not the effects of the disease. And that's what we're now able to do. We can treat the cause so that we don't have the effects.
Thank you, Dr. Keller. Always good to see you.
Good to
Appreciate
see
the
you,
good
Ken.
news, too.
I like
That's
your
good.
beard, by the way.
Thank you. Well, you would. I'm trying to keep up with you. If you'd like to learn more about Dr. Keller's Perio Protect method, 314-638-4190 is the number to call, 314-638-4190, or visit his website, drdwaynekeller.com.